Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist working in UK. And this morning, I have a junior doctor with me, Dr. Anusha Akella. Anusha is a IMG from India who came to UK in 2017. And the reason I'm doing this interview is because we wanted to share her experience of working as a psychiatry trainee. She's currently working as a CT1, but she's also tried some other specialties prior to starting her training in psychiatry in UK. So I thought it would be a good idea to ask her about the experience in psychiatry, the things she like, and also, she may be in a position to compare her psychiatry with other specialties she's worked in the past. So, a lot of IMGs might ask me, I have interest in medicine or GP and psychiatry, which one to choose. So maybe she can give us some answers of what was her reasons, and maybe that may be helpful for some of the IMGs. So Anusha, first of all, thank you very much for joining me and giving me your time.
No, thank you, Dr. Ahmed. I think it's really great that we're doing this. It's really helpful. Thank you.
So first thing I will ask you, if you can share your journey so far as a doctor, from MBBS onwards, and how did you come to UK, and what have you done so far here?
Sure. So, like you rightly said, I did my med school in India in Hyderabad. I graduated in 2016, and soon after I came to UK and I did my PLAB 1, PLAB 2, and then GMC registration. And then I started working in Luton in 2017, July. And so I did like a couple of years of trust grade jobs down south in Luton and Surrey, mainly in acute medicine and geriatric medicine. And then I decided to get into internal medicine training or co-medical training. And I did that for a couple of years from 2019 to 2021. And then after that, I came into psychiatry in August last year.
That's very good. So you have broad experience. I think that's very important when you are coming to psychiatry. I'm sure it was appreciated that. So one of the reasons, one of the things people would say that they will say that I don't have any psychiatry experience in the past, and this will be my first job. I have done medicine, surgery, other things in the past. This will be my very first job as a CT1 in psychiatry, and they have this anxiety that that I don't know much about psychiatry. Would I be able to cope with that? So in that, I'm sure you may have gone through similar anxiety in yourself. So how did you find that? Did you find the CT1 role as in psychiatry was uh, well suited for a person with your degree of experience, or you thought you out of place?
Yeah, I definitely felt that before I started my CT1 job, because I didn't have any psychiatry experience at all in NHS. And before coming to the NHS, I think I just did a month or so of psychiatry in India again, which is very different from what it is here, isn't it? So I did feel that, but I think as a CT1, when you're starting without any psych experience, although it can be intimidating, they kind of like settle you in quite slowly. And there is the team usually when you're working with is generally, from my experience, is very, very supportive. So I started my psychiatry co-training with an inpatient job, inpatient general adult psychiatry. It was quite a high turnover, acute busy ward. But having said that, it was, although the first few weeks, it did take a bit of time for me to find my feet, but soon after I was able to get into the things, and I was supported very well by my colleagues. Consultant was very supportive, my registrar, seniors, and the whole nursing staff. Everybody was very, very helpful. And I think it was a few weeks, and within a few weeks, I was quite comfortable in my role.
Okay. So talking specifically about psychiatry, what was your rationale for choosing psychiatry, or what was the things that was actually attracting you as when you were working in medicine towards psychiatry?
So I always found the subject quite intriguing and quite interesting, but I never actually, I don't know, I never actually viewed myself as a psychiatrist for a while. And I just kind of, when I got comfortable with doing medicine, and I kind of went with the flow in the beginning. But I think during the pandemic time, during COVID time, I think the importance of mental health kind of resurfaced everywhere, all over the world around that time. And I was working in ITU during the second wave, during the peak of second wave in pandemic. And at the time, I thought there was a lot of, it just showed how important how important it is to have a good, strong mental health to carry on with our lives, isn't it? I think that's when I started reading a lot of books about psychiatry, not like textbooks, but in general, like nonfiction and fiction books about psychiatry. And I thought, towards the end of my IMT2, I thought I should give this a try, and I would like to do this as something as a daily job, actually.
So you are in your CT2 year in psychiatry, and now if you compare it back to medicine or other subspecialties you have done, do you think you have made the right choice in terms of liking the job and having that?
Yeah, I think it is one of the best decisions I've made, to be honest, in my life. I'm very, very happy with the decision of coming to psych. And like I said, initially I wasn't, because I didn't have prior experience, I wasn't sure what to expect from the job. So I spoke to several consultants. I spoke to yourself as well before coming in, and just to see what the practical aspect of psychiatry and see how the work-life balance and everything is. And actually coming in, I am very happy with my decision, and I think I did make a right decision.
So you were talking about your first job. I mean, I was just thinking if you can explain a little bit to what to expect, when you start as a court trainee. Most of the time, court trainees start as you said, in a general adult job or sometime in an old age job as well. What do you think they should expect from the first psychiatry job? And also, if you can talk us through your on calls as well, then how do they work?
Yeah, sure. So I'm not sure how it is in the community, because both my second job currently and my previous job, both of them are inpatient. So I think I'll be able to talk about inpatient. So initially, I think the first few days, it was basically kind of shadowing the consultant and shadowing the registrar and seeing how the meetings are done, how the ward reviews are done. And then sitting in through the meetings, and sometimes they will be supervising us and we'll be taking history from the patients and talking to patients about their medication, if there is any medication changes, under supervision. So basically it is around patient reviews, initially sitting in and then trying to take a bit of a lead under supervision. And there's a lot, because it is an inpatient job, what I saw, there was a lot of medical issues rising on the ward as well, because they're on quite a lot of medication. And so we are there to follow up on the medical side of things. And coming to on calls, I think mainly it is covering any medical emergencies or any medical issues, because you'll be doing ward cover across multiple wards, and sometimes overnight it is across a couple of sites as well, 2 different sites. So taking in any admissions, and then doing their drug charts, doing their bloods, ECGs, and that kind of admission workup, and and then doing any medical, if there are any medical issues arising, then troubleshooting those. And sometimes I think another thing, which is probably one of the most important things that do come up on calls, is doing 5-2s when patients who are informally admitted and they ask to leave, and then you go and assess them and see if they're detainable, and then doing the 5-2 forms and that kind of, yeah, mainly surrounding these, I think.
And in terms of your on calls, the routine of on calls, how often are they happening? And are you covering nights as well, or are you covering crisis assessments in the nights as well?
So in where I work in our trust, we don't do the crisis assessments overnight. I mean, I've had 2 sets of nights so far, like 4 and 3, and I cover Chester and Clatterbridge, 2 sites, and it's mainly inpatient wards that we cover. And the nights are not that frequent, but because they're shared across 2 sites, I think you do get a good amount of gap between one set of nights and the other. And the day on calls, we're just based on one site, either Chester or on Clatterbridge, and then you do in the new admissions and that kind, and again the medical reviews and those. But we don't. I haven't actually done any. We haven't actually shadowed any mental health assessments in A&E or that kind of assessments yet.
And another thing, a lot of people are sort of ask me if they are interested in psychiatry, they say that they might think that they can only work in psychiatry, or that will just improve their CV. I think one of the things I normally advise that, if you have medical experience, if you have
Mhm.
medicine and other specialties, that experience is actually not wasted. When you come to psychiatry, your medical expertise are still required. When as you mentioned, you were on the ward, and doing ECGs, doing physical health reviews. That kind of is also part of a psychiatrist's life. So it's not when somebody is working in medicine, they shouldn't really think that their time is getting wasted, because they are actually learning things that will be useful. Is that something you found as well from your experience?
Yeah, absolutely. I think I definitely agree with that. I think my whatever the medical experience I've had has come in very handy, because I think overnight, especially, you're the only doctor, as opposed to in like an acute hospital wherein you have other doctors and things. But overnight, you're the only doctor. Although you do have the registrars over phone, you can speak to them for advice, but having some amount of medical experience helps in prioritizing jobs and taking some decisions, and mainly taking decisions like, do we need to send them to A&E now, or is this something that can wait till the morning? That kind of rationaling and decision making definitely helps. Yeah.
And another thing which psychiatry is, can say we are unique, or we do more often, is that we are supposed to give our juniors some supervision time, hourly supervision time, weekly, and also psychotherapy experience as well, and weekly postgrad um, uh,
Teaching.
teaching, yeah, and
Yeah.
presentations. Is that something you found in your trust, and is that something you find helpful in terms of developing yourself?
Yeah, absolutely. I think supervision and teaching and balance groups are kind of like um, really that's what that actually what keeps me going as well in psychiatry, to be honest, because we get a lot of teaching. We get every Wednesday afternoon. We have local teaching where we do present a case. There is a journal club, and then there is an expert-led session as well. So you get an opportunity to teach, and also you're learning at the same time. So, and that time is quite protected every Wednesday afternoon. And in Northwest, we also have regional teaching, which is alternate Thursdays, which is like a full day, and that's basically teaching for the exams, MRC Psych exams. So I found that quite helpful as well. Um, and coming to supervision, we do get a lot of supervision. I think it's supposed to be like an hour every week, but it kind of differs depending on the nights and on calls and the consultants' commitments as well. But we do get regular supervision, wherein the consultant kind of like goes through the portfolio and makes sure we're on top of things, and any issues or any queries we're able to raise during that supervision sessions. And Ballant Group, I think people who haven't worked in psychiatry would probably not know a lot about Ballant Group. And I was somebody like that to start with. And I found it a bit like we're supposed to come up and talk about how the case has made us feel. And this is not something we've done in the past. We do case presentations and things in other specialties, but they're very technical driven. What investigations have you done, or what medication have you given? But this is more like how the case made you feel, and you talk through that with a small group of peers and the tutors. Initially, I was not really sure about this, but I think after 6 months of Ballant, it really helps to talk through how the patients make you feel, or how the cases made you feel, and how to kind of address those emotions, especially in our mental health specialty as well. So I think Ballant is really helpful. I was saying this to my tutors as well, that all specialties should consider having a Ballant group, to be honest, because it's really helpful for the trainees.
Yeah, I think it's good that you mentioned Balance Group, because as a junior doctor in psychiatry, I thought when I first started that I learned a lot of psychiatry through Balance Group, a lot of psychology, a lot of emotional reactions, and how emotions can affect us, and how can we actually read the emotions of a patient, and sort of how to look at them in a different way. Sometimes we can get be stuck in a lot of medical model. If somebody has depression, I just need to give them antidepressants. Somebody has anxiety, I need to give them and
Yeah.
anxiety tablets. But actually sort of understanding the emotion, where they're coming from, why
exactly.
are they feeling at that particular time in a way, in the background. That helps a lot, and that's something you actually really learn from the parent group. I
Mm.
just At the end, I just want to ask you, what would be your advice to the IMGs who are considering psychiatry? I mean, I want to ask you in two different ways, because I get a lot of people asking me that they are confused between GP and psychiatry, in medicine and psychiatry. So you've experienced both worlds. So one aspect of question is that, if people are confused between specialty, what would be your advice to them? And generally, if people who are genuinely interested in psychiatry from the start, maybe we can talk about them as well.
I think, yes, last year when I applied for both for GP and psychiatry, and I was already doing medicine at the time. And I did have to make this decision between going for GP or psychiatry. And both, I didn't have experience in either of them. I hadn't done GP before, I hadn't done psych before. But I think what made me choose psychiatry was, I think inherently I was more interested in the subject as such. And then I think talking to several people about their experience in psychiatry, and the work-life balance that they find in psychiatry. And also, I think one other thing that I found that made me choose psychiatry was that you get, I think you get more time with patients as opposed to when you're in a GP. I think it's quite stressful. You get little amount of time and you have to do a lot. Whereas in psychiatry, you get a little bit more time to spend with patients, be it community or within the ward as well. So I think those were the few things that made me choose psychiatry. But I think by the end of the day, it's your inherent interest which will which should make you choose between a specialty.
And as a junior, and as a more junior doctor or a medical student, so if you have to go back in time, and or say, for example, if you have to advise some medical students who are actually working in third year, fourth year now, and they're thinking about psychiatry. So I personally I wish, if I can go back and advise myself, I would probably ask myself to explore this a bit more during the medical studies, because we were, at least the medical school I came from, we were more focused on surgery and medicine. And
Yeah,
psychiatry was in the background, in the
yeah.
background noise, and only people who are genuinely interested were going there. So would you there be any advice for those medical students who are actually at that stage? So how can they explore their interest in psychiatry?
Um, I think if they are really interested, I think maybe trying. I don't know how it works because I haven't done my foundation here.
Yeah.
I don't know how it works, but maybe trying to get like a foundation job in psychiatry, like an F1 psychiatry job, which will give them more insight about what the specialty is all about, and they can make a better decision when it comes to choosing a specialty. And also, like I totally agree. It was the same when I was doing medicine as well. It was all about medicine, surgery, and obs and gynae and those subjects, and we didn't actually focus much on psych. But I think it is a little bit different here, because I've done some teaching sessions for medical students, and there are and medical students who are quite interested. They're quite enthusiastic during those teaching sessions, and they come onto the ward and try to find patients, interesting patients to look at, do the mental state exams and all this kind. I think, yeah, being just enthusiastic in their curriculum and trying to find an F1 job if they can, just to get the taste of the specialty, I think will help.
So thank you very much for your time. I think this
No
was
worries,
great that
thank
you
you.
have given some good insight into psychiatry, and especially, I think, as I said, people who are actually looking into that, and trying to gather more information. This interview will be very useful for them. Thank you for your time.
Thank you for doing it, Dr. Ahmed. Really appreciate it.